Isang malusog at mapagpalang hapon po sa lahat ng nakasubaybay ngayon sa ating Kapihan with Media via DOH Facebook at YouTube pages saan mang bahagi ng ating bansa. Ang inyo pong lingkod mula sa kagawaran ng kalusugan, ako po si Lynn Legarteja na nag-aanyayang halika na't makinig, makibahagi at matuto sa mga eksperto ng kalusugan. Pero bago po tayo opisyal na magsimula, let me first read our house rules. To ensure the smooth flow of this session, everyone is encouraged to 1. Use the naming convention below for Zoom usernames to ensure proper acknowledgement. 2. Pay attention to the discussion of our health experts and/or resource persons. 3. Keep your microphones muted while speakers are discussing and presenting. 4. Should you have questions, participants shall signify and send them in the Zoom chat box and wait for the host to acknowledge them. There shall be an open forum after the discussion, and submitted questions will be addressed first by our experts, followed by the Zoom chat box questions. Every participant is also advised to reserve their questions. Only questions related to the topic discussed will be entertained. Lastly, please join the Kapihan with the media until the last part of the session. Kung atin pong matatandaan, idineklara ang ikatlong linggo ng Nobyembre ng bawat taon bilang Drug Abuse Prevention and Control Week alinsunod po sa Presidential Proclamation No. 124 upang isulong ang kamalayan ng publiko laban sa masasamang epekto ng paggamit ng iligal na droga. Gayon din po ang pakikipagtulungan ng bawat mamamayang Pilipino laban sa anti-drug campaign ng gobyerno. Dahil po dito, ating tatalakayin sa ating Kapihan with Media ang celebration of the Drug Abuse Prevention and Control Week. And to discuss the Philippine Anti-Illegal Drug Strategy, we are blessed to have with us today an employee of Dangerous Drugs Board for about 14 years now, who started as a public information officer in 2009. She then became the head of the agency's Media Affairs and Public Relations Unit. And in 2020, she was appointed as the Assistant Chief of the Dangerous Drugs Board's Management Information Systems Division. And just this year, she was assigned as the officer in charge of the agency's conference secretariat. Please help me welcome Ms. Ella Marie Repumanta from the Dangerous Drugs Board. Good afternoon po, Ma'am Ella.
Good afternoon, Ms. Lynn, at sa lahat ng ating mga tagapanood at tagapakinig dito sa ating media forum. Alright, so muli magandang hapon po sa ating lahat. First and foremost, on behalf of the Dangerous Drugs Board, I would like to thank the Department of Health for inviting us to this online media forum. Ako po, personally, I am very happy na maging bahagi ng mga initiative kung saan maipapaliwanag at maipapalaganap natin yung ating advokasya laban sa illegal na droga. As mentioned earlier by Ms. Lynn, this November, particularly on the 3rd week of November, we are commemorating the Drug Abuse Prevention and Control Week, or the DAPC Week. The 3rd week of November is designated as the DAPC Week since 1973. Taon-taon po natin itong ipinagdiriwang para i-promote yung public awareness on the ill effects of using drugs at himukin na rin yung publiko na maging bahagi nitong ating kampanya laban sa illegal na droga. This year, the DAPC Week celebration carries the theme, People First, Stop Stigma and Discrimination, Strengthen Prevention. So in this year's celebration of the Drug Abuse Prevention and Control Week, the Dangerous Drugs Board is placing emphasis on the need to put people first in the core of all drug prevention and control programs and measures. Putting people first means recognizing the complexities of their struggles, addressing the root causes, and extending a helping hand to persons who use drugs. Eliminating stigma around persons who use drugs requires proper understanding and acknowledgement that drug use is a health issue and that the drug problem is not just a security concern. By approaching illegal drug use with empathy and understanding, and by facilitating access to proper care, we pave the way for healing, we build bridges to recovery, and we create lasting change in our communities. Masasabi nga po natin no, that we have come a long way pagdating dito sa usapin ng illegal na droga. Itong problema natin ay hindi lang problema ng seguridad. This is not just a law enforcement concern. This is a complex problem which requires a multifaceted, comprehensive, and balanced solution. At ito po yung gusto kong ibahagi din sa inyo ngayong hapon. So my presentation today will focus on the balanced and comprehensive approach to the country's drug abuse problem. And I also hope to share with you, to our viewers here, na itong ating kampanya laban sa illegal na droga is a whole-of-nation approach at maipapanalo lang natin itong ating kampanya kung bawat isa po sa atin ay susuporta at makikiisa. And speaking of pagsuporta at pakikiisa, masaya po kami na makita yung partisipasyon ng iba't ibang grupo, iba't ibang sektor dito sa ating kampanya, lalong-lalo na po nitong ating nagdaang DAPSI Week celebration. So before I proceed with the topic, I would like to share with you some photos of the activities during the DAPSI Week celebration. Next slide, please. Ayan, so kicking off the celebration was a simultaneous pledge of commitment to remain drug-free, participated by local government units, different national government agencies, schools, and universities nationwide. Kasama po dito sa pangako nila ay yung pagiging kasangkapan ng ating mga anti-drug advocates upang matigil yung stigma at discrimination laban sa mga taong gumagamit ng mapaganib na gamot or illegal na droga. Next slide. And no less than the President, si President Bongbong Marcos, encouraged the whole nation to support the anti-drug advocacy. Iba't ibang programa pong isinagawa ng iba't ibang grupo at organisasyon sa iba't ibang panig ng bansa. Nagkaroon tayo ng mga drug abuse prevention programs, capacity building programs, mga advocacy programs tulad ng fun run, poster making contest, and other activities highlighting yung tema ng ating selebrasyon na People First, Stop Stigma and Discrimination, Strengthen Prevention. Next slide. Ayan. So this afternoon, I would like to take this opportunity to share the government's programs and strategies in the campaign against illegal drugs. Sa pangunguna po ng Dangerous Drugs Board, we have what we call the Philippine Anti-Illegal Drugs Strategy. Next slide. Brief background lamang po about our agency. The Dangerous Drugs Board is the policy-making and strategy formulating body on drug abuse prevention and control. Next slide. Ang amin pong ahensya is a board composed of several agencies, kabilang na po dyan ang Department of Health. The logos of agencies on your screen comprise the Dangerous Drugs Board. The board is led by a chairman in the person of Secretary Catalino S. Puy. Yung workforce naman po ng board is led by our Executive Director, Undersecretary Earl P. Saavedra. Ito pong mga ahensyang ito ang nagpupulong upang bumuo ng mga polisiya, strategiya at programa upang solusyonan yung ating problema laban sa illegal na droga. Kaya tayo po ay mayroong tinatawag na Philippine Anti-Illegal Drug Strategy o PADS. Next slide. So ano nga po ba itong PADS? Ano ba yung ating strategy? Our strategy involves the implementation of a comprehensive and balanced approach on drug supply and drug demand reduction. Drug supply reduction measures are aimed at taking drugs away from the public through market denial operations and regulatory measures, preventing the diversion of drugs from the licit to illicit market. Ito po yung trabaho ng ating mga law enforcers. So sa aspeto pong ito, meron po ba tayong maitutulong dito sa ating kampanya? Of course, meron po. Malaking bahagi ng success ng ating mga supply reduction efforts ay dahil sa pakikipagtulungan ng ating mga mamamayan. Yung mga impormasyon na galing sa ating mga mamamayan sa publiko tungkol sa mga illegal drug activities sa kanilang lugar ang naging susi ng ilan sa mga matagumpay na mga law enforcement operations sa pangunguna ng Philippine Drug Enforcement Agency o PDEA. Balancing the strategy are drug demand reduction efforts kung saan ang mga mamamayan naman po ang sentro ng ating programa. Drug demand reduction programs are aimed at taking people away from abusing drugs. Kumbaga, kabaligtaran na sa drug supply. Sa drug supply, yung droga, yung inilalayo natin sa publiko. Dito sa drug demand reduction, the public ang ilalayo natin sa paggamit ng droga. And we do this by informing them, empowering them with the right information, and capacitating them with the right skills to remain drug-free and healthy. In my following slides, ipapakita ko po sa inyo yung ilang mga particular na polisiya at programa laban sa illegal na droga. Next slide. Ito, I want to highlight this policy. Noong 2019, inilabas po ang Board Regulation Number 7, consolidating the rules governing access to treatment and rehabilitation programs and services. Layunin po ng regulasyon na ito na i-guide yung ating mga duty bearers at maging yung ating mga persons who use drugs or PWUDs sa proseso ng pagbibigay at pag-access sa mga treatment and rehabilitation programs. This regulation is geared towards addressing the drug use problem through a public health approach. Mayroon po tayong ditong minandate na client flow kung saan ang isang taong gumagamit ng droga ay kailangan sumailalim sa screening upang ma-determine ang angkop na treatment and rehabilitation program para sa kanya. Marahil marami po sa atin ang intindi natin pag gumagamit ng illegal na droga, automatic dapat i-confine sa isang rehabilitation facility. Following the client flow, kung titingnan po natin, maiintindihan natin na may iba't ibang programa na naaayon sa klase ng drug use disorder na mayroon ng isang individual. Ang isang PWUD, maaari po silang lumapit sa ating mga anti-drug abuse councils. Meron yan sa level ng barangay, city or municipality, provincial hanggang sa regional level. Kinakailangan po yung ating mga PWUD na mag-undergo ng screening. Pwede itong gawin ng mga trained health workers sa ating mga barangay. Dito malalaman yung risk level ng isang individual. And those with low risk level will be referred to general interventions na available sa ating mga communities. Yun namang may moderate risk are referred to community-based treatment and rehabilitation services na dapat available at accessible din sa ating mga komunidad. Yung mga may high risk, kung high risk ang resulta ng kanilang screening, they will have to undergo a drug dependency examination para malaman naman yung level or severity ng kanilang substance use disorder. Yung merong mga mild substance use disorder, they are referred to community-based treatment and rehabilitation programs. Again, available ito sa mga communities. Yung merong mga moderate substance use disorder, sila ay nire-refer sa mga outpatient facilities, while only those with severe substance use disorder are referred to inpatient treatment and rehabilitation. So sa pamamagitan po ng regulasyon na ito, nagkaroon tayo ng mga community-based programs, yung mga programa on treatment and rehabilitation na available at accessible sa ating mga komunidad. Hindi po lahat ng mga PWUDs kailangan i-confine sa isang facility. Marami po sa kanila ang mga ngailangan ng community-based programs. Hindi nila kailangan lumayo sa kanilang mga pamilya, hindi kailangan tumigil sa trabaho o pag-aaral, hindi madidisrupt ang kanilang pamumuhay para sila ay gumaling, makabangon at makapagbagong buhay. Next slide. So, ilan pa po sa ating mga recent policies are flashed on your screen, no? You can also view and download these regulations from the website of the Dangerous Drugs Board, www.ddb.gov.ph. In the interest of time, hindi ko na po iisa-isahin pa yung mga regulasyon na ito. I just want to highlight na yung ating pong mga policies ay nakabase sa mga evidence-based information and of course are also anchored on the Comprehensive Dangerous Drugs Act of 2002. Next slide. On your screen are some more recent regulations of the DDB. These aim to guide our duty bearers in the implementation of their responsibilities, of their tasks in the campaign against illegal drugs. Next slide. Now, I would like to share with you some of our drug abuse prevention programs kung saan maaari rin pong maging bahagi yung ating mga mamamayan. These are implemented by local government units, anti-drug abuse councils, schools, and other groups and partner agencies nationwide. Mayroon po tayong flagship program for the youth na tinatawag po natin na Barkada Kontra Droga, kung saan ang layunin is to create a group of young individuals who will lead and influence their peers towards the adoption of healthy and drug-free lifestyles. Isa po kasi sa mga pangunahing rason pa rin bakit gumagamit ng illegal na droga, lalong-lalo na yung mga kabataan, is peer pressure. Kaya naman gusto po natin to turn this negative peer pressure around. Yung mga kabataan po mismo ang mangunguna sa pagsusulong ng healthy at drug-free lifestyle sa kanilang hanay o sa kanilang sektor. We also gather the youth in different fora to raise their awareness on the ill effects of drugs. Maging yung mga out-of-school youth po natin, meron din po tayong programa katulang ang ating mga LGUs. Mayroon din po tayong tinatawag na life skills enhancement training kung saan pinapalakas po natin yung mga skills ng ating mga kabataan na tutulong upang maiwasan nila yung impluensya ng illegal na droga. This program involves enhancing their skills such as self-esteem, communication, decision-making, and assertion, among others. Maging sa mga bata po, meron tayong programa at an early age, natuturuan na po sila ng mga skills on how to say no to drugs. Next slide. And we also have programs to strengthen our families. We have the Family Drug Abuse Prevention Program, systematic training for effective parenting, at Strong Families Program, among others. Yung ating mga families po kasi serve as protective factors para mailayo tayo sa impluensya ng droga. Parents who undergo these programs are provided with knowledge and skills for them to better appreciate their roles in drug abuse prevention. Next slide. Marami pa po tayong ibang mga programa, no? You can also visit the website of the Dangerous Drugs Board to know more about these programs. The DDB, we offer help to workplaces in capacitating them on drug abuse prevention education. Yung ating pong mga kumpanya, businesses with 10 or more employees are mandated to have a drug-free workplace policy and program. May training din po tayo for different sectors. Kabilang na dyan yung ating mga pharmacists, doctors, health professionals para ma-update po sila tungkol sa mga bago nating regulation on drug prevention and control. We also capacitate duty bearers tulad ng ating law enforcement, judges, prosecutors. Yan pong mga nabanggit ko ay ilan lamang iyan sa ating mga programa, no? Again, you can visit the website of the Dangerous Drugs Board for more information on these programs and for the complete list of available drug abuse prevention education programs. Next slide. Ayan. So just to conclude the presentation, I just would like to emphasize na malaki po talaga ang bahagi ng bawat isa dito sa ating kampanya laban sa illegal na droga. Unang-una, napakalaking tulong na po kung ang bawat isa ay mananatiling malaya sa impluensya ng droga. Bonus pa if we can influence our family, our friends to remain healthy and drug-free. There really is a need for all Filipinos to commit to actively participate in drug prevention and control initiatives, in actions which are anchored on the rule of law, respect for human rights, and promotion of public health and safety. So that ends my presentation. Maraming salamat po sa inyong pakikinig.
Maraming salamat din po, no, Ma'am Ella. Maraming salamat po sa pagbabahagi sa ating mga kababayan. As Miss Ella mentioned, of balanced and comprehensive Philippine anti-illegal drugs strategy and policy. Gayon din po ang iba't ibang mga programa na ipinapatupad po ng gobyerno para sa drug prevention. Tayo naman po ay tutungo sa ikalawang bahagi ng ating kapihan kung saan ating na magtatalakayin ang mga isinasagawang kampanya laban sa illegal na droga that is now gearing towards the community-based treatment, rehabilitation, education, and reintegration to curb the drug dependence among Filipino who use drugs. To discuss all this, we have with us today the Department of Health Promotion Bureau's focal point for the substance use, drugs, and detection, who provides policy, research, and technical support in these priority areas. He has 7 years of experience in public health and holds a Bachelor of Science degree in Industrial Pharmacy from the University of the Philippines, Manila. Please help me welcome Mr. Jude A. Deval Santos from the Department of Health. Good afternoon, Sir Jude.
Magandang hapon po sa ating lahat and a healthy celebration of the Drug Abuse Prevention and Control Week po for 2023. So I'd like to introduce our campaign for drugs with the recognition of drugs and substance use as health issues. The mental health in the next slide acknowledges drug dependency as a mental health issue. In line with this, substance abuse prevention and treatment is identified as one of the 3 ultimate goals to be achieved in the mental health landscape of the Philippines from 2024 to 2028. This is especially with the launch ng ating mental health strategic plan for 2024 to 2028 last October 12, 2023. In the next slide, it shows na for 2024 to 2028, we have identified substance abuse prevention and treatment. The mental health law also redirects our efforts towards the institutionalization and for community-based management of mental, neurological, and substance use conditions. Literature also reveals that not all people who use substances or drugs need intensive treatment in a facility, and that their needs could be addressed or treated within their own communities. So providing health and social services to those who use drugs as close as possible to where they are or in their communities minimizes disruptions to education or employment, and it facilitates help seeking and access to treatment. So the national government, the DOH, and other agencies would like to bring this message and our services closer to the people within their communities. In the next slide, the DOH, with the leadership of Secretary Ted Herbosa, developed the 8-point action agenda, which operationalizes priority health and health-related issues in the country. And this includes mental health and substance use. So under action item number 6, ginhawa ng isip at damdamin, the department seeks to enhance Filipinos' well-being and ensure quality mental health services. Further, in the next slide, President Marcos, on his second SONA, has also indicated the campaign against illegal drugs is now geared towards community-based treatment, rehabilitation, education, and reintegration to curb drug dependence among our Filipinos who use drugs. And as part of this campaign, we are introducing this community playbook, which packages a menu of community-based interventions and shall serve as a guide to our LGUs, our local government units, in localizing various community-based interventions that fit to their health situation and needs. In the next slide, makikita po natin kung ano ang nilalaman ng isang playbook. So, each playbook module should be composed of the following. So, meron tayong evidence brief, template policy, implementation checklist, basic resource requirements list, requirements for capacity building ng ating LGUs or communities, communication plan, at monitoring and evaluation plan, and lastly, yung ating frequently asked questions. So, anong makikita sa isang evidence brief? It helps our local implementers na ang kanilang actions ay backed up ng data which supports the effectivity ng program na nag-i-influence sa ating health outcomes. Sumunod dito yung template policy, so it is easier to support and sustain our programs with a healthy public policy, and it employs a multi-sectoral approach. So, hindi lang health sector, so kasama ng iba't ibang actors sa ating community tulad ng law enforcement, ang ating education and social welfare and development office. Matutugunan natin ang pangangailangan ng community with regard to drugs. Kasunod nito ang isang implementation checklist. So, it guides our local implementers on what key steps are necessary to undertake to ensure successful implementation ng iba't ibang programa pagdating sa pag-address sa substance use sa community. Kasama dito ang isang resource requirements list. So, it enables us to estimate how much investment needs to go in providing for our various interventions in the community. We also have our capacity building requirements. So, this equips our local implementers with proper knowledge and skills important para ma-implement yung interventions na makikita sa playbook. We also have a communication plan. This helps effectively increase the demand for our programs through suggested activities and template IEC materials. We also have our M&E plan, so monitoring and evaluation, so that yung ating mga implementers sa baba will have the know-how to measure yung success, pati yung impact na nagagawa ng iba't ibang interventions and programs. Meron din tayong FAQs, yung frequently asked questions, which summarizes yung iba't ibang must-knows para ma-implement yung ating playbook. Sa susunod na slide, makikita natin na yung ating playbook aims to respond to the entire continuum of care for substance use. So, mula sa health promotion and prevention hanggang makarating tayo sa integration. So, pagdating sa health promotion and prevention, meron tayong family skills-based program na isang intervention designed for families with children, and it aims to improve parenting skills, child well-being, and family mental health. Meron din tayong REACH, kung saan isa itong unang step para yung to get people to seek help, and it focuses on increasing the understanding of drug use and how to prevent or help our substance users through social and behavior change. Pagdating sa screening na parte ng ating pag-address sa substance use, meron tayong tinatawag na SBIRT or Screening, Brief Intervention, and Referral to Treatment. So, nakapaloob dito yung mga tools sa pag-assess whether the service user or the person who uses drugs is at risk of dependence. Meron din itong brief interventions such as psychoeducation, psychosocial support, and psychological first aid, depending on the results ng screening. Meron ding referral to appropriate level of care depending dun sa risk na makukuha pagdating sa screening. Sa pagdating naman sa treatment, meron tayong ginhawa at KKDP. Nakapaloob sa playbook kung anong meron at kailangan para ma-implement itong iba't ibang intervention sa continuum of care. Pagdating sa ginhawa, it aims to develop our ability to manage stress through positive coping strategies, handling negative emotions and thoughts, strengthening interpersonal skills, problem-solving skills, and supporting self-efficacy. Meron din tayong KKDK to help our persons who use drugs demonstrate improved recovery and life skills and engage their families in planning for their recovery. So kasama o katuwang ang kanilang pamilya para maplano at mapaghandaan ang kanilang recovery. So hindi lamang siya ang person who use drugs, ang kaakibat na mag-address ng substance use, pati ang kanyang pamilya at ang komunidad. At ang pinakahuli sa pinakadulo ng ating continuum of care, pag-reintegrate o pagpababalik ng ating person who use drugs sa kanilang community, kasama dito ang ating Yakap Bayan program from the DSWD, which helps our recovering clients and yung pamilya nila to overcome the challenges that they face in their recovery and can be offered depending on the need of the client. In the next slide, the playbook also presents case studies from various LGUs. So this provides experiences and best practices of these LGUs regarding their specific drug problems that may help inspire and set similar ways for other local government units to implement their community-based programs. So sa playbook, meron tayong examples mula sa Pateros, sa Pasig, Quezon City, General Santos, at yung interlocal health zone sa province of Leyte pagdating sa kanilang community-based. In the next slide, makita natin na na-launch itong ating playbook sa Butuan City, Caraga ngayong linggo lang din, noong November 22, 2023. And to end this presentation, not all people who use substances or drugs need intensive treatment, as mentioned earlier. Providing health and social needs and services to people who use drugs as close as possible to where they are minimizes disruptions. So the national government would like to bring this message again and our services closer to the people within their communities. So with the playbook, we hope na magkaroon ng example at ma-inspire ang ating iba't ibang LGUs kung paano mag-respond sa drug use or sa substance use. Muli, maraming salamat po.
Thank you very much, Sir Jude, for sharing with us the initiatives of the Department of Health in collaboration with other national government agencies to curb the drug dependence among Filipinos, especially po, yung nabanggit nyo kanina, the implementation of the community playbook, which shall serve as a guide sa ating mga LGUs in localizing the various community-based interventions that is fit to their health situation and needs. So, Ma'am Ella, Sir Jude, hindi ko na po patatagalin pa at tayo po ay tutungo na sa huling bahagi ng ating Kapihan with Media na Q&A portion. For the first question is, this is for Ma'am Ella. What is the primary goal of our celebration of Drug Abuse Prevention and Control Week for this year? And follow-up question din po, nakma dito, why is awareness crucial po sa pag-achieve natin sa goal na ito?
Yes, thank you for the question, Ms. Lino. Yung ating, katulad ng nabanggit na kanina, yung ating Drug Abuse Prevention and Control Week is celebrated every year to raise awareness on the harmful effects of illegal drug use. At gusto rin po natin na i-foster or hikayatin yung partisipasyon ng publiko dito sa ating kampanya. Gusto po natin na mas marami pang maging anti-drug advocates dito sa ating bansa. Mahalaga yung information, yung correct information tungkol sa ating problema sa droga, tungkol sa ating mga programa, maibahagi yan sa publiko para sila mismo ma-encourage na mag-participate. Ipinapaalam din natin ano yung mga available programs and accessible programs natin on prevention, pati na rin sa treatment and rehabilitation. Yung celebration natin this year, this is aptly themed as put people first, stop stigma and discrimination, strengthen prevention. So sa pamamagitan ng iba't ibang programa, binabahagi natin yung tamang kaalaman on drug prevention and control. Yung kaalaman nito kumbaga nagiging sandata ng ating mga kababayan upang makaiwas sila sa impluwensya ng illegal na droga. Importante rin yung correct understanding, appropriate understanding kung ano ba yung drug use disorder, at para ma-address natin yung stigma at discrimination against persons who use drugs o yung ating mga PWODs.
Thank you so much po, Ma'am Ella. The second question is for Sir Jude. Can you elaborate more on the specific strategies po employed by the Department of Health to address the drug abuse within the communities?
Yes po, Ms. Lynn. The DOH through its regional offices, yung ating Centers for Health Development, nagsacertify po sila ng ating community-based drug rehabilitation program by LGU. So this is with regard to their public health services component. This includes yung, as mentioned earlier, yung continuum of care from health promotion, prevention, screening, treatment, and rehabilitation. And nagpo-provide din ang ating CHDs ng technical assistance in capacitating our communities or our LGUs in the provision of these health services. So ang yung strategies, this is based on the need of the LGU, and it should tailor fit to whatever the health situation and needs of the communities, and the DOH provides technical assistance.
Tama. Thank you so much po, Sir Jude. The third question for Ma'am Ella. What are some effective strategies for preventing drug abuse among the young adults? And how can this be highlighted during the Prevention and Control Week? I think kanina na-mention na po natin, no, yung sa drug prevention po natin sa youth. Siguro i-reiteration na lang po.
Yes, so na-mention ko nga kanina yung mga programa natin to prevent the use of drugs, especially among the youth, no? Nandiyan yung Barkada Kontra Droga, meron din tayong life skills training. Siguro idagdag ko lang, no? Sa ating mga mag-aaral, sa mga nasa schools natin, we make sure na yung mga drug prevention and control concepts are included in the school curriculum. Meron tayong tinatawag na National Drug Education Program. Para naman dun sa mga kabataan na nasa komunidad, we have the Special Drug Education Centers. I just also want to share with you na yung mga programa po natin na nagbibigay ng mga healthy alternatives para sa ating mga kabataan, tulad ng mga sports clinic, music and arts club, and similar activities are also effective strategies para magkaroon po ng healthy outlet, healthy coping mechanisms yung ating mga kabataan. So those are just some program strategies we can implement in our communities.
Thank you so much po, Ma'am Ella. Yung susunod po nating question, I think both Ma'am Ella and Sir Jude ang pwede pong sumagot. How does the DOH or DDB work to prevent the illegal production and the distribution of drugs as part of its comprehensive approach to drug abuse prevention? Una na lang po, Sir Jude.
Yes, Ms. Lynn. So yung government efforts for the supply reduction, particularly on illegal production and distribution of drugs, are mostly provided by our law enforcement agencies. So on the DOH side, the FDA as an attached agency of the DOH regulates distributors of drugs. This includes yung pag-distribute ng controlled drugs in the country as part of their mandate. We would like to reiterate that the appropriate use of controlled drugs, that is for medical and scientific purposes only, through our policies and standards.
Thank you, Sir Jude. Ma'am Ella, do you have anything to add po?
Tama yung sinabi ni Jude, no? Basically, law enforcers' duty rin itong supply reduction, but we at the Dangerous Drugs Board, kasama ng Department of Health and other partner agencies, we ensure na appropriate, responsive yung ating mga policies para sa pangangailangan natin to control drug production and drug distribution.
Thank you very much po to the both of you. Yung question naman po natin na susunod is for Ma'am Ella. What are the key elements po of a comprehensive treatment program for individuals or Filipinos struggling with drug addiction, and how can communities facilitate the access to these resources, especially in the far-flung areas?
Yes, Ms. Lynn, yung pinakita kanina ni Sir Jude, no, yung ating pong treatment and rehabilitation programs must address all aspects ng drug use or dependence, yung whole continuum of care. So yun po yung nais nating makita sa ating mga treatment and rehabilitation programs, inpatient man o community-based programs. Kasi nga po tulad ng nabanggit kanina, no, marami sa ating mga persons who use drugs ang mga ay meron lamang mild substance use disorder at mangangailangan ng community-based treatment and rehabilitation. Kami po sa Dangerous Drugs Board, hinihikayat natin yung ating mga local government units, no, na magkaroon sila ng kanilang mga community-based treatment and rehabilitation programs, o dapat alam nila kung saan i-refer yung mga persons who use drugs. Sa DDB po, we provide financial assistance to LGUs na merong mga programa at nangangailangan ng physical structure to house their community-based treatment and rehab programs. So, kung kailangan po nila ng assistance for their structure, the Dangerous Drugs Board can grant assistance to them. Kailangan lang po nila mag-request, ipadala sa amin yung kanilang letter of request, yung program of works nila, yung information about their services, at ano yung kailangan nilang structure para maisagawa itong mga programang ito.
Ma'am Ella, add ko lang, no, since na-mention niyo po kanina na ipadala lang po sa kanila, can you announce now? May ma-announce po ba kayong telephone numbers or email po kung saan po sila pwedeng makapag-send ng mga services na kailangan po nila?
Yes, Ms. Lynn. Yung ating mga requests from local government units can be sent to the Dangerous Drugs Board through our official email address. That's info@ddb.gov.ph. Maaari rin po sa email ng Conference Secretariat, which the Office of the DDB, which also facilitates itong ating financial assistance, sa boardsec, BOARDSEC, @ddb.gov.ph.
Thank you so much once again, Ma'am Ella. We are down now to the last two questions. So this question naman po is for Sir Jude. Anong maipapayo natin sa publiko upang malabanan ang stigma and discrimination towards people seeking help for drug addiction?
Yes, Miss Lynn. So, as Filipinos, no, we have to recognize as well that drugs, substance use, and addiction are health issues too. And we have existing interventions that can cater to their health needs. Meron tayong interventions na available sa communities. So, in addition to that, the mental health law provides a basis in treating them as such as health issues. We also have to keep in mind as well that our president also recognizes and indicated in the second SONA na we can also gear towards community-based, especially meron tayong literature na nagsasabi na meron tayong not all should be treated in facility unless mataas yung kanilang drug dependency or severe. And we hope to our community playbook that our communities can help spread this message of health and reach them within their own communities.
Thank you so much po, Sir Jude. This is the last question na po for the both of our speakers, Sir Jude and Ma'am Ella. Ano po ang maipapayo ninyo sa mga pamilya kaibigan, o malapit sa buhay ng isang individual seeking help for drug addiction? I think, Ma'am Ella, kayo po muna.
Yes, no, siguro unang-una, Miss Lynn, yung acknowledgement na merong condition yung isang individual na gumagamit ng droga. And in order to help the person recover din, we have to make him understand na kailangan din niyang humingi ng tulong. Minsan kasi, diba, hindi mo naman kaya na ikaw lang. So, meron tayong mga malalapitan, merong handang tumulong din sa atin mula sa ating gobyerno, sa mga institutions, pati na rin sa ating mga komunidad. So, yun lang, we acknowledge the condition, the problem, and we refer the individual to the appropriate help in order to assist him in his or her recovery.
Yes, thank you po, Ma'am Ella, no, tama. Malaki rin yung role ng mga pamilya, kaibigan, kasi merong mga individual nga po na syempre may iba in denial sila na hindi sila nagsisik ng help. So sana yung mga nakikinig ngayon na mga kapamilya, kaibigan o kalapit sa buhay, sana mainganyo po nila or bigyan po natin sila ng impormasyon hinggil dun sa mga natakil po natin, no, na meron pong mga ganitong programa ang gobyerno para tulungan sila. Sir Jude, I think meron po kayong dadagdag.
Yes po, in addition to the families, nandito ang ating government, ang ating health sector na nagre-recognize na itong mga problema na to ay parte ng kalusugan. These are health issues, and we have health services that could cater to the various situations and needs nila. And aside from the DOH, marami ding agencies na nag-a-address. We have the DSWD, the DDB, and the DILG. So, hindi sila nag-iisa at ang national government ay may range of services para makatulong.
Thank you very much po. That will be the questions for our Q&A. But before we officially end our Kapihan session for today, may I ask for your takeaway messages po? Pabaong mensahe lang po sa ating mga kababayan na nakikinig ngayon. Unahin na po natin ulit, Ma'am Ella.
Yes, maraming salamat, Miss Lynn, Sir Jude, maraming salamat din sa iyo, sa lahat ng ating mga nakikinig, no. Kami sa Dangerous Drugs Board, as what we advocate, we continue to advocate. We should always put people first, no. Let us help eliminate stigma around persons who use drugs. By eliminating stigma, we foster yung understanding and yung support. We should replace judgment with compassion so that we create a society where everyone, regardless of their struggles, is empowered to seek help, to recover, and contribute positively dito sa ating shared journey.
Yes po, Sir Jude, your takeaway message.
Reiterate ko lang din po, as I've mentioned earlier, providing health and social services to people who use drugs as close as possible to where they are. So it may be within their communities, minimizes disruptions sa kanilang education, employment, and it facilitates yung pag-help nila ng ng kanilang health seeking and access to treatment. So yung ating playbook, i-plug ko na lang din na we hope that our LGUs can see na may iba't ibang models and options to respond to drugs and substance use in their communities. And ang ating playbook, nakapaloob dito yung iba't ibang experiences and best practices ng iba't ibang LGUs sa buong bansa na makakatulong, maka-inspire sa kanila kung paano nila i-implement yung kanilang community-based program for substance use.
Thank you so much, Sir Jude. Maraming salamat din po, Ma'am Ella. Gayon din po sa Health Promotion Bureau at Dangerous Drugs Board sa pagpapaunlak po sa aming imbitasyon na kayo po ay makasama namin sa ating Kapihan with Media ngayong araw. Sa ating mga tagapakinig, lagi po nating aalalahanin na naririto ang kagawaran ng kalusugan at iba pang ahensya ng gobyerno, hindi lamang po para masigurong healthy ang bawat Pilipino, kundi sapat rin na kaalaman sa iba't ibang mga sakit, paano ito maiiwasan o di kaya'y paano maibabatid ng gobyerno ang mga serbisyong pangkalusugan sa bawat Pilipino. Mula noon hanggang ngayon, ang kagawaran po ng kalusugan ay nagpapasalamat sa aming mga media partners sa patuloy na pagiging katuwang sa pagpapalaganap ng tamang impormasyon pangkalusugan. Muli po ang inyong lingkod mula sa Kagawaran ng Kalusugan. Ako si Lynn Legarteja at magkita-kita tayong muli sa susunod na Kapihan with Media. Maraming salamat po at sama-sama tayo sa isang healthy Pilipinas kung saan bawat buhay ay mahalaga sa bagong Pilipinas. Thank you po!